Hello everyone, I am Dr. Rashid Hassan, the founder and CEO of DentoScope Institute of Research and Advanced Dentistry. Uh, well, I am the university examiner for University of Health Sciences Lahore for about 10 to 12 years now. So basically, the main concept of these lectures, these series of lectures by DentoScope, is to clear the concepts in of dental materials regarding different topics. So let's get started with this today's topic, which is on impression materials. So, impression materials. What exactly the impression materials are? Well, we are very much familiar with the fact that the impression materials, they are used in almost every prosthesis fabrication. Like if you want to make a crown or a bridge or a denture work, impression material is the first step in the fabrication of that prosthesis. And yeah, exactly, I would like to clear your concepts regarding impression materials. Today, I will talk about the introduction, classification, and non-elastic and elastic impression materials. If you have any questions, any queries, you can write in the chat box. I will get back to you all and then answer all your queries. So, proceeding further, before starting to the main topic, I would like to clear a few terminologies, because these terminologies are going to be used every now and then in the coming slides that you are going to see. So you should have a clear concept about each and every one of them, so you do not mix things up once we proceed further. So the first thing is the hydrophilic impression materials. What is the difference between hydrophilic and hydrophobic materials? Well, as the name suggests, hydrophilic means they have strong affinity for water, and hydrophobic is obviously the opposite of that. Um, well, if we talk about the hydrophobic and hydrophilic materials, well, just keep this thing in mind that oral cavity is not at all what you can say dry environment. It is always a wet environment. It is the orodental structures are always covered by a very thin layer of saliva. So those materials are suitable and ideal for have the strong affinity for water, because these materials get into close proximity with the orodental structures, and they can record the impression in a much accurate way, right? So ideally every material must be hydrophilic, but obviously there are certain materials which are hydrophobic. So obviously we don't have to do a lot of you can say that for those materials we try to avoid such materials, because we want to get a clear and a very accurate impression. So that's the difference between hydrophilic and hydrophobic. Then you should have a clear concept about the setting time and the working time. Well, there is a very minute difference between setting time and working time. Like if we go towards the setting, it is the time from the start of the mixing until the material is firm enough to resist the permanent deformation. Like when you mix powder and liquid, they both, when and start mixing them into a rubber bowl, what exactly happens? Well, the time from the start of that mixing till the material is finally set, that is your working time. The total time is till the end, when the material is finally set, that is your setting time. The working time is different. Well, working time is the time from the start of mixing until the impression is fully seated without any distortion. Well, it is again when you start mixing powder and liquid formulation to make a smooth creamy mixture without any air bubbles. You insert it into the impression tray and then you seat it into the patient's mouth. So all this time on which you have worked on that material, that is your working time. So working time plus the time inside the patient's mouth when the material is finally set is your total setting time. So that's the difference between working time and setting time. Moving ahead, there are two terminologies: addition and condensation. Addition polymerization reaction and condensation polymerization reaction. Well, there is if you must have studied in the polymers that polymers polymerize by any one of the two methods, either by addition or condensation reaction. What exactly happens? The single chain, the monomers, they combine with each other and form a large macromolecule, which is polymer. And the process of formation of these minute monomer, conversion of these minute monomers into a large macromolecule is called as polymerization, and it can be either by addition reaction or condensation. The only difference between the addition and condensation polymerization reaction is the formation of byproduct. The byproduct is only formed in the condensation polymerization reaction. No byproduct is formed in addition polymerization reaction. That's why we prefer those materials which can be polymerized, which can get set by the addition polymerization reaction. Now, coming to the introduction of impression, what exactly an impression is. An impression is a negative replica or reproduction of the orodental structures. Well, the main emphasis here is the negative replica. What exactly the negative replica means? That whatever the structures that you see inside the oral cavity, those elevations, like teeth are basically the elevations from the ridges, from the bone, right? These elevations come as depression in the dental impression. So when we take an impression, the depressions are seen, which is basically the impression of the teeth. So it is the negative of that, right? So it is basically the impression is the negative replica. Whatever the crust, troughs, the elevations, depressions, whatever do you see inside the oral cavity, they will come as opposites in the dental impression, right? And the materials that we use to record the dental impressions of the tooth structure and the surrounding oral tissues, well, that is impression are that materials are called as impression materials, dental impression material. Here you see a terminology of auxiliary dental materials. Well, if you have studied in the starting of your course, the dental materials, they are divided into four classes. There are four main classes of dental materials. Number one are the preventive dental materials. Number two are the restorative dental materials. Number three are the temporary restorative material, and number four are the auxiliary dental materials, right? Impression materials, they come under the classification of the auxiliary dental materials. What exactly the auxiliary dental material mean? Auxiliary dental materials are those materials which help in the fabrication of any prosthesis, but do not become the part of the final prosthesis, right? They help to make that prosthesis, like the impression materials, model and die materials, dental waxes. They are helpful. They help in the fabrication of a denture, right? But when the final denture is formed, it doesn't have any impression material. It has no gypsum product or model or dry material. It has no waxes in it, right? So these are the materials. The auxiliary dental materials are basically those materials which help in the formation of any prosthesis or device or appliance, but do not become the part of that final prosthesis, right? So impression materials, they are categorized as auxiliary dental materials. Then the next point says that the impression materials, they can be used to produce the replicas of both intraoral as well as extraoral tissues. So we are very much familiar with the intraoral tissues like teeth, gingiva, frenum, etc. These are, we are familiar with that, right? Because we record these impressions. What exactly do we mean by the extraoral tissues, the extraoral structures? Well, in some cases, right, for example, there is a road traffic accident. For making, and there is severe, you can say, injury which the patient has encountered. So, like if he has lost any eye, ear, nose, you being a prosthodontist has to replicate that as well. You have to rehabilitate that patient, right? For making the prosthetic ear, prosthetic eye, prosthetic nose, you have to take the extra oral impressions. And these impression materials are also used to record those extra oral structures. So that's what is meant by this last point, that the impression materials are not only used for the for recording the impressions of the intraoral structures, but also the extraoral. Well, then comes a very big question, that why? Why do we need an impression material? Well, we being a dentist, well, we do not have the indoor facilities, right? Like the medical one. When a patient comes to a medical doctor, he or she is admitted into a ward until the treatment is completed. But on the contrary, as a dentist, the patient comes to you like for a denture or a crown or a bridge. You cannot keep the patient with yourself because in the ward, because you don't have the indoor facility, right? So we want the exact replica of that patient's oral structures, so that we can send the patient and give him or her the next appointment when he can come and get his prosthesis done, right? So that's why impression materials are very much important, and the choice of a suitable impression material is also very important, because you cannot ask the patient to come again and again to record just the initial stage, like the impression. So it is a one time procedure. You record the impression, you send the patient, you give him the next appointment, ask the patient to come for in about 2 or 3 days, when the lab finally makes his denture, and you can easily insert it into the patient mouth. That's why the impression materials are important, because we do not have the indoor facility. And well, these are the few of the pictures that you can see, which will clear your concept. Like here you can see the alginate impression material in a rubber ball with spatula and impression tray. You start mixing it with water, and once you start mixing it, you make a smooth creamy mixture without any air bubbles in it. Then once all the mixture is without any air bubbles, you just load it into the impression tray. Then you seat the tray into the patient's mouth with the impression material in it. Then you ask the patient for some tongue movements, which you will learn in the final year of your professional examination. You ask, that is for the functional impression. You ask the patient for certain movements, and once the material sets, you just take the impression material out along with the tray. And this is well, if you see this picture right now, well, this picture, it shows all the teeth, right? So the definition, if you remember, I told you that dental impression is the negative replica. So the patient, let's suppose this patient has the teeth in his oral cavity. So all the teeth inside the oral cavity, they have come as depressions here, right? So it is a negative replica. So how we convert this negative replica into a positive one? Well, there are few pictures that will clear this thing. Then we mix plaster of Paris, soft plaster or hard plaster. We mix it with water. We make a smooth, creamy mixture, and then we insert it into the dental impression. then we leave it for some time until the gypsum product, or you can say the model and dye material, it can set. Once it gets set, we separate the impression tray and the impression material. We do not need it anymore. Now we have got the positive replica. So this is exactly what the patient has in his oral cavity, exact replica of the orodental tissues. So a model or a die is the positive replica, which is being made, you can say, by the negative dental impression. So that's how you convert a negative replica dental impressions into a positive one. And here in this picture you can see the difference between the a dentate upper jaw and the edentulous upper jaw. Now coming to the ideal properties, well, there are certain standards that we set for every material. Whatever material you are going to study in the subject of dental material, the first thing you will come across is going to be the ideal properties. What exactly are the ideal properties of that specific material? And same is that ideal properties is basically the standard which the material must meet. But obviously these are the ideal properties. There are very few materials which exactly meet these standard. So I have divided the ideal properties of the dental impression materials into four categories: the biological properties, the chemical properties, physical and mechanical properties, and the miscellaneous or other properties. So we'll go through them one by one. So what exactly are the ideal biological properties of a impression material? Well, obviously it should be should not cause any adverse effect on the health of the operator as well as the patient. Well, that operator can be either your assistant or yourself as well. And the patient, obviously it should be biocompatible, non-toxic, non-irritant. It should not have any adverse effect on the patient or the operator or you being a dentist. So it should be inert. Then coming to the chemical properties, it should not react with the other materials, for example model and dye material. Obviously you have seen in the couple of slides back that the negative replica was converted into the positive one by model and dye material, right? There was an impression material, and then you mixed plaster of Paris, the soft plaster or a hard plaster, and you inserted it into the impression. So ideally there should be no reaction between the model and dye material and the existing impression material. Then secondly, it should not react with the other materials during the setting process. Like other materials, what exactly the other materials are, like it comes in contact with the bowl, spatula, impression tray, right? So and when, if let's suppose these are the elastic or non-elastic impression materials except elastomers, well, there are latex gloves that the operator or the dentist must be wearing. So any other substance, it should not come into contact with that. Even if it does comes into contact, it should not react with that. It should be inert for that material as well. So it should not have any sort of chemical reaction with any of the substance or with any of the other material it comes into contact. Well, it should form a very strong bond with the impression tray. Obviously we want a very good bonding between the impression tray and the impression material, because I will show it to you in a couple of slides from now, that the impression trays, they have a handle with which you unload it from the patient's mouth. So if there is not a strong bond present between the impression tray and the impression material, the impression might remain inside the patient mouth and you are only left with the tray. So a strong bond, a good bonding is necessary between the impression and the impression tray. Well, it should have the ability to get disinfected. Obviously you cannot use that impression and send it to the lab without disinfecting it. It is ethically your duty being a dentist, or you can ask your assistant to disinfect the impression. It should not produce any byproduct. Well, obviously, because the concept behind this byproduct thing is that, let's suppose if a material has five components, one, two, three, four, five, and after reaction, one of that component is leached out as a byproduct. So the properties are going to be changed. The properties that we desire from that material, that are going to be changed, because one of the material has leached out, the one of the component of the composition has leached out, right? So ideally it should not produce any byproduct. Then coming to the physical and the mechanical properties, the first is the thixotrophic behavior. Ideally, every material must have the thixotrophic behavior. What exactly the thixotrophic behavior means? That if you keep alginate, for example, alginate, you see a change in the physical nature of alginate right from the start of mixing until it finally set. Like, it should have the property of changing into from a solid to a liquid, a semi solid, then a liquid form, and then finally set into a solid form. So this change of you can say of behavior is called as the thixotrophic behavior. Like, it changes its physical shape. So ideally material should have a thixotrophic behavior. It should change into different form before finally setting, and that is important because because of this thing you can easily work on the patient. Then it should have enough time of mixing, loading of tray, and then setting into the patient's mouth. Obviously it should have enough working time, as we discussed in the start. It doesn't mean that you have started mixing it and after some time, before inserting it into the patient mouth, the material is set. So it should have, ideally it should have enough working time, so you can perform all the steps very easily, not in a hurry, right? Well, coming next is the it should be elastic enough to be withdrawn from the undercut areas without any deterioration. Well, it should have the elastic property. Every material should have the elastic property. Once you remove it from the patient's mouth, it should not break into the undercut areas. Undercut areas are basically the areas between the two adjacent teeth. In a couple of slides I will show you that undercut area as well. So it should easily move from those undercut areas and then keep its shape, right? It should not break in those undercut areas, because those undercut areas are very much important. We also want to record each and every fine detail of the orodental structures. Then the fourth point is it should not shrink. Yeah, obviously it should not shrink. There is the limit given 0.1 to 0.27%. Okay, that is acceptable. But more shrinkage means that your final prosthesis, your final denture, that is going not going to fit inside the patient's mouth, because your impression that has shrunk. So the all the stages coming ahead, right, to the fabrication of the fabrication of the prosthesis, the denture, everything will be of a smaller size, because your impression that shrinks. So your final device, your final prosthesis, that is also going to be of a smaller size. And acceptable discrepancy is about 20 to 50 micrometer. Okay, if discrepancy is more than that, well, that is not acceptable. Well, it should not deform permanently. Yes, it should not deform permanently, because we need to use that ideally we should be able to use that material, that impression again for duplicating the cast, right? There are two types of cast: the working cast and the diagnostic cast. So ideally the material should not deform permanently. Then it should have a tear resistance. What exactly does it mean? That once you remove it from the oral cavity, once it is finally set and you have removed it from the oral cavity, it should not tear away, right? It should remain intact. The molecules of the final set impression material must be intact with each other. Well, it should have a neutral color and taste, because that will be acceptable for the patient as well. That it should have the acceptable taste and acceptable color, because there are certain material, like especially in the elastomers, whose color is not very much acceptable for the dental patients. Okay, then coming to the miscellaneous or other properties, well, it should be radio opaque. Well, radio opaque means that you can easily capture it into the radiograph, right? Why it is important? Why impression material must be radio opaque? Well, let's suppose in some cases you have recorded an impression and you have sent the patient for the next appointment, and patient comes to you and says that he or she is feeling some pain in the gingiva, in the gums, right? So if the impression material is not radio opaque, you won't be able to see it in the x-ray. If the material is going to be radio opaque, you can simply take the x-ray, you can see, okay, there's some segment or some part of that impression material that has stuck between the teeth or inside the gingiva, that is causing the problem. Because if in case it is not at all radio opaque, you won't be able to see it in the x-ray. So it should be radio opaque ideally, so you can easily see if any fragment is left inside the oral cavity or gingiva, right? It should be easy to handle. It should require minimum equipment like alginate, just bowl and spatula. Ideally it should not require those hi-fi mechanical devices, like in case of most of the elastomers. The manipulation must be very much simple. It should be cost effective, right? It should not be very much expensive, because that is going to affect your pocket, I would say. Because if the material is not is very much expensive, you are using an expensive material for a simple work, well, that's not going to serve your purpose, right? So it should be, the cost should also be in your mind, that the material must be cost effective. So you can choose an ideal material for any specific application. Like if you want to make a 1 or 2 unit partial denture, right? The acrylic partial denture, you will not use those elastomeric impression materials, because they are not cost effective. They are very expensive material. You can only use those expensive material if you want to record the impression of some expensive treatment, like implants, like crown, bridges, etc., right? So for simple procedures like making 1 or 2 unit or even a complete unit of the denture, you will not use those elastomers. Rather you will prefer alginate or impression compound. And here is some comparison given of the prices of few of the impression materials, and here you can easily see that alginate is by far the most cost effective of all the impression materials. Well, now coming to the impression trays. Well, the impression trays, well, they are divided into 3 types: the stock trays, disposable trays, and the special trays. Well, first of all, we talk about the stock trays, which are commercially available. They have standard sizes. They can either be smooth or they can be perforated. Well, you must have seen it in the in your lab work, that there are some impression trays which are smooth, which have smooth surface, while there are some others, especially the plastic ones, which are perforated. And the perforations are only for interlocking purpose, right? Because when you load the impression tray with the impression material and you insert it into the patient's mouth, the excess material, it comes out from those perforations, from those tiny holes. And once the material gets set, those the excess material, it also gets set. And so there is an interlocking procedure, and there is a bond formed between the impression tray and the impression material. So those perforations are for that purpose. In case of smooth trays, well, there are certain adhesives available for the permanent bond between these impression tray and the impression materials. Well, they can either be made up of plastic or metal. Both type of these stock trays are commercially available. Well, then coming to the special tray, also called as the custom tray, because you make it by your own self. You use polymethyl methacrylate, or simply called as self-cure acrylic, to make this impression tray. And you can easily see here in the first picture that the impression acrylic impression tray is formed just like the stock trays, right? You just mix the self cure acrylic and then you put it on the model, and then you record the secondary impression, right? From a primary impression you make the model, then you make a stock tray, the special tray, and then you record the secondary impression. So these are basically disposable types. After you record the impression you need to throw them away because they are only specific for that specific patient. Then coming to the disposable tray, they are single use only. Well, they are mostly perforated, and they are used in those patients when the patient come to you, you definitely record the history, and if there is any transmittable disease, you prefer using these disposable tray which are made up of nylon. Well, here is the difference between the upper impression tray and the lower impression tray. Well, I will also tell you that during this lecture I will also tell you the few questions that are mostly asked during the OSPE examination and the written examination. So this question is mostly asked in the OSPE. When you go in front of the examiner, there is a whole tray filled with the different materials. Impression trays are also there, so examiner sometimes asks you to pick up the maxillary and mandibular impression tray and tell the difference. What's the difference between the maxillary tray and the mandibular tray? So here you can easily tell the difference, that you can easily see the palate in the upper jaw impression tray, the maxillary impression tray, whereas there is a tongue space present in the mandibular impression tray. So that's this very significant difference by which you can differentiate between the upper and lower tray, and you need to tell this to the examiner to go through this question. Well, now coming to the classification of the impression material. Well, actually I have made this lecture from 2-3 books, so I have incorporated all the 3 types of the classifications I found in the different books, so they are present at one place for you. Well, classification is divided into 3 types. There are 3 types of classification. One is on the basis of the impression techniques, second on the basis of the setting properties or the elastic behavior, and the third one is on the basis of viscosity. So any of these impression classification can be asked from you during the exam, but most commonly the second type, which is on the basis of the elastic behavior or the setting properties, that is most commonly asked in the exam. Well, we'll go through it one by one. First, let's talk about the classification of impression material on the basis of the impression techniques. Well, it is divided into 2 types. Either it can be mucostatic or mucocompressive impression technique. So these are the 2 types of techniques: mucostatic impression technique or mucocompressive impression technique. So what's the difference between mucostatic impression technique? The technique in which the impression material is fluid enough to flow and does not displace the oral tissues. These are the mucostatic impression technique. The materials are called as mucostatic impression materials. Like the material has the viscosity of very fluid in nature, right? Very thin viscosity. They can easily move around the orodental tissues because they are in a fluid state, right? And once you record the impression from that impression material, they do not displace the orodental tissues. They remain static at their position. The orodental tissues, they remain static at their position. So that's why they are called as mucostatic impression materials. And the impression materials are the impression plaster, agar-agar impression material, zinc oxide impression material, and light body elastomers. So these are the four types of material which have thin viscosity and they do not displace the orodental tissues. They are in fluid form. I mean, they once they are mixed, their viscosity is very thin. They are fluid enough to flow around the orodental tissues and do not displace them. On the contrary, the mucocompressive impression materials are those, well, in which the impression material is viscous, is thick, and is able to compress the oral tissues on insertion into the patient's mouth. So these are thick materials. They have high viscosity. They are not as fluid as the mucostatic impression material. So once you record an impression from the mucocompressive impression materials, they compress, as the name tells, they compress the oral dental tissues. Whereas the mucostatic impression material, well, they do not, what you can say, they do not displace the orodental tissues. Whereas these impression materials, they compress them, and they include the impression compound, viscous alginate, regular, high, and putty consistencies of the elastomers. So these are the impression materials which compress the orodental tissues, and that's why they are called as mucocompressive impression materials. So this is one classification on the basis of impression technique. In one technique, orodental tissues are not displaced. In other technique, the second one, the orodental tissues are compressed. So these are the two techniques, and the materials are divided in these two types. Well, here, this is the most commonly asked classification in the university examination, and you should have a clear concept about it. It's just a flow chart, and if you draw this flow chart in the exam, well, you get full marks for that, because it contain all the impression materials in one place. One thing you will notice that the impression material, they remain the same, but once you change the category, the classification, well, they just shift from one side to the other. So on the basis of the setting properties or the elastic behavior, the impression materials are divided into either non-elastic or elastic, right? Non-elastic, it means they are rigid impression material. This is also a terminology used in the exam, that name the rigid impression material. Well, they are non-elastic. They do not have the elastic property. So if you are asked to name the rigid impression material, these are the non-elastic ones. They include the impression plaster, impression compound, and zinc oxide eugenol impression paste. These are non-elastic impression materials. They do not have the elastic properties. Then coming to the second category, which is the elastic one. Well, elastic impression materials, they are divided into two types: hydrocolloids and non-aqueous elastomers. Well, I will once we move ahead, I will tell you what exactly the hydrocolloids are. Well, hydrocolloids are of two types: agar and alginate. These are the two impression materials. Agar is reversible hydrocolloid, alginate is irreversible hydrocolloid. So that's the difference between both of them, but both are the hydrocolloids. Then elastomers, well, they are they are the most expensive of all the impression materials. Well, they are polysulfides, silicons, or the polyethers. These are the three types of the elastomers. Silicons are further divided into addition silicon or the condensation silicon, depending upon the polymerization reaction. If you remember in the very first slide, I told you about a few terminologies, and one of those terminology was addition polymerization reaction and condensation. So addition silicons, they polymerize by addition polymerization reaction. Condensation silicons, they get polymerized by condensation process, and the byproduct is only formed in the condensation silicons, because we know that addition polymerization reaction, it doesn't give any byproduct. Well, the polysulfide, well, they have they're just the catalyst and the different lead dioxide. Well, that's the component. So elastomers are basically three polysulfide, polyethers, and the silicones. Then silicones are further divided into addition and condensation ones. So this is the whole classification which is mostly asked. 70 to 80% of the questions are asked from this classification. Then the third type of classification is on the basis of viscosity. On the basis of viscosity, we divide the impression material into three types. Well, the first one is the high viscosity, medium viscosity, and low viscosity. Well, you should have a clear concept. The viscosity is basically the property of fluidity of any material, right? I will also arrange one lecture on the properties of general properties of the dental material, in which I will elaborate each and every property. Just keep this thing in mind, that high viscosity, medium viscosity, and low viscosity. It means that they are either thick consistency, medium consistency, or a very low or fluid consistency. So what are the materials, impression materials, which have the high viscosity? Well, there are two main types, impression compound and the putty elastomers. Well, you will see impression compound, it is included in this lecture. I am going to show you this. Putty elastomers, well, I don't think the putty elastomer is shown. I think in very few cases it is shown to the dental students, because it is, as I told you, these elastomers are very much expensive, about 14 to 15,000 for one pack of this elastomer. So it is very expensive. So mostly the students are taught manipulation on the alginate, which I just told you that they are the most cost efficient, cost effective of all the impression material. So putty consistency of the impression material is basically, if you remember, plasticine, which the children used to play with that material. It is just like that. It has the thick consistency, it has high viscosity impression material. So impression compound and putty elastomers are the high viscosity. Well, then coming to the medium viscosity, well, they have intermediate viscosity, not very thick, not very thin, and they contain regular body elastomers. Elastomers have four consistencies: regular, high, medium, and putty consistency, right? So high consistency, the putty consistency elastomers, I have shown you that they are high viscosity. Regular body elastomers, well, they have medium consistency. They are not very thin or not very thick like the putty one. Then coming to the low viscosity, well, these are all the impression materials remaining. They come into the category of the low viscosity impression materials. Like if you pay attention, that impression materials are the same right from the start, right from the first classification that I elaborated. Impression materials are the same. You just changed the basis, right? You just changed the category, and all the impression materials, they just fell into different categories. Well, in low viscosity, impression plaster, impression paste, which is basically zinc oxide eugenol impression paste, then hydrocolloids, which are reversible or either irreversible. I told you in the setting behavior classification that agar is reversible hydrocolloid, whereas alginate is irreversible. I will elaborate what exactly the hydrocolloid is. You will get much more clear concept about it in the coming slides. Then the light body elastomer, obviously it is light body elastomer, so it has low consistency, so it will come in the heading of the low viscosity impression materials. Now let's talk about the non-elastic impression materials first. I have included non-elastic and elastic impression materials in this session of lectures that I am delivering today. Next time I will arrange a lecture for the elastomers. Well, impression plaster, impression compound, and zinc oxide eugenol impression paste. These are the non-elastic impression materials. We'll go through them one by one. First, let's talk about the impression plasters. Well, now we see I have elaborated different types of impression materials to you: impression plaster, zinc oxide, eugenol, impression paste, this agar, alginate, and then the high performance elastomers. But when this is basically the evolution process of the impression material. In the start, we had just this impression plaster as the impression material. It is just like the soft plaster that you use in the lab, right? Only that material was used at that time in the initial stages of the evolution of in dentistry, in dental materials. So impression plaster was used at that time. Then we definitely the material scientists thought of having some elastic properties, and then this evolution process started. So let's start with the impression plasters. Well, impression plaster is basically a gypsum product. When you will see the topic of gypsum product, it has 5 different types of classes. The first type is the dental plaster for recording the impression. Other types are for making the model or die. So the type 1 of gypsum product is basically the dental plaster for recording the impression. What exactly a dental plaster is? Chemical. This is a very important MCQ. This one, the chemical name of the impression plaster. It is beta calcium sulfate hemihydrate. This is a clear. Concept should be clear that it is basically hemihydrate, not a dihydrate. The plaster form that you get in the lab, that is in the hemihydrate form. The water of crystallization is taken out from it. When you mix it with water, it becomes dihydrate. Then it is called as calcium sulfate dihydrate. But as a dentist, it is available to a dentist in the form of hemihydrate, right? So chemical name of impression plaster is beta calcium sulfate hemihydrate, and then you mix it with water to form a dihydrate. And for mixing, you can either mix it with water, or there are anti-expansion solutions available, but on regular basis we mix plaster with water. So what are the different steps? Well, I have categorized it into different steps so that you can easily understand them, and these steps are very important for your OSPE, because you are asked to manipulate impression plaster on one of the OSPE stations. And when you do that, if there is any question, you can write the steps of manipulation. So these are the steps that you can see here. So you can write these simple steps, and all works good for you. Then first, step 1 is that you measure 50 ml of the room temperature water in calibrated measuring beaker, where there are different beakers available. It is an irony that we don't get those measuring beakers from the suppliers, but in the past those special beakers were provided for the for measurement of the water content. Then we measure the 100 gram of gypsum, which is the plaster. Well, use a flat wooden handled stainless steel spatula. Well, there are different spatulas available. Well, the way I teach dental material, I start from real basics, and in my first lecture that I delivered to my students, I just tell them about different instruments and where these instruments are used. So there are different types of spatula you see in the dentistry. Either they can be cement mixing spatula, there is a plastic spatula available for the alginate mixing, and there is one spatula which is metallic, but the handle is made up of wood. So that is used for mixing the impression plaster, right? Then we place the rubber ball. After mixing, we place the rubber ball on the vibrator, and that basically is done to remove all the air bubbles from the mixture. We don't want any single air bubble, right? That is because of the reason, because if there is any air bubble left in the mixture and you make a plaster, a model, or you record an impression from that one, once that air bubble evaporates, there will be a hole present inside your impression, which is not at all acceptable. That is not the exact replica of the orodental tissues, because inside the oral cavity of the patient there was no hole present. So, how can a technician fabricate any denture work if the impression is not accurate? So, this is a very important step, that there should be no air bubble present once you mix the impression plaster. So, that's why you put it on the vibrator, so that it vibrates and removes all the air bubbles. And then final mix should appear as a thick cream like consistency. Like, you just take the mixed impression plaster on the spatula, and then you drop it into the same rubber ball. It should be just like a cream. That is a smooth creamy mixture that was used. Now it is not used. Impression plaster is not used nowadays, because we have much better impression materials. But initially when it was used, well, that was the criteria to check either it is ready to load into the impression tray. So, what are the disadvantages and advantages of the impression plaster? Well, it has the thixotrophic property, initial fluid state. It capable of recording the soft tissues in uncompressed state. It is, what does it mean? That it is mucostatic impression material, if you remember, right? It does not compress any orodental tissues, so it records very excellent, although it is not used now because of certain disadvantages which I will mention you later. But it recorded excellent impression, very excellent impression, because it is a hydrophilic material. It absorbs water, it gets very close to the orodental tissues, so it recorded very accurate impressions. But there were certain problems, because of which we discarded it. Okay, so now coming to the second point, it absorbs water from the tissue surface. Well, that's a very big advantage. Like, as I told you in the start, that the oral cavity is always moistened with the saliva. And okay, even if it is a very thin film of saliva present, but even this impression plaster, if it even absorbs that thin film as well, it gets closer to the orodental tissues, so it gives you much more accurate impression. So that's a very big advantage of the impression plaster. Well, useful in recording of the impressions of the excessive mobile teeth and flabby ridges. Well, that's the point where the concept of the mucostatic impression materials comes. If there is a flabby ridge, if there are mobile teeth present, the ridge is also flabby. The impression plaster, being a mucostatic impression material, it easily flows around those mobile teeth, even those flabby ridges, and records the impression in the uncompressed state. Well, that was the big advantage of that. But there was a reason why we discarded it, why we don't use it anymore. Dry sensations to the patients due to the absorption of water. Obviously, the saliva which is present inside the oral cavity, Allah subhanahu wa ta'ala has given this as a blessing to us. The oral cavity keeps moist because of this saliva, and if there's no saliva present, the oral cavity will be very much dry, like xerostomia patient, right? So oral cavity must be moist all the time. The dry sensation is because it absorbs all the saliva as well. Well, that gives a very irritating effect to the patient because of this dry sensation. Then there is no elastic property. If you remember the second classification, in the second classification, the impression plasters were classified as non-elastic impression material. They are not at all elastic, and once you remove them from the oral cavity, the undercut areas are broken. because elastic, they do not have the elastic property, so they cannot record the undercut area, the undercut area which is present between the two teeth. Like teeth are not like piano keys straight, like they have different curvatures, so there is some point where this impression plaster, once you remove it, it breaks into piece. Then the this is the big disadvantage, the last one, the exothermic reaction. Well, that was a very big disadvantage. If you must have worked in the lab, and you must have made that plaster slab, which is part of your exercise in the second year BDS in dental materials. When you make that plaster slab, you just check it after some time, it gets warm and very warm, and then certain after some time the temperature starts to drop down, right? The same material is was used to record the impressions. The impression plaster is the same material from which you are making the plaster slab. So just imagine the mucosa inside the oral cavity, that is very thin. It is a very thin layer of mucosa, and these exothermic reaction, it generates a lot of heat. It used to burn the mucosa. So that's a big disadvantage of the impression plaster, because it causes dry sensations and it used to burn the oral mucosa due to exothermic reaction of due to its setting. So if you see here, this impression plaster, it is ideal material. If you see the advantages, it records very good impressions, very close proximity to the orodental tissues. It absorbs even the thin film of saliva as well. It gives you all sort of the advantages that you need, but we cannot compromise on the biocompatibility. We cannot compromise, being a dentist, we cannot compromise on the health of the patient. Even it has 100 good properties, any material, if it has millions of good properties, but it is not biocompatible, it is not it is causing problem to the patient, we just discard it. And that's why we discarded it, we removed it, we went on to make some good materials, because it was causing problem to the patient, like dry sensations, and obviously this exothermic reaction was a very big disadvantage. And that's why the material scientists came to the need of formation of these elastic impression materials. Well, indicated where it was indicated for the edentulous patient. Well, all the non-elastic impression material, just it is a rule of thumb, all the non-elastic impression materials are used to record the impressions of the edentulous patient. If you see the picture, if the teeth are present inside the oral cavity, what exactly, you can easily see the undercut areas, the tiny triangle between the teeth, the very tiny triangle, that is the undercut area. Well, this impression material, the rigid impression materials, they cannot record this undercut area, because once you will remove the tray, this impression material will break from here, because it has no elastic property, it cannot move all around the curvature of the adjacent teeth and then again retain the same shape. It will definitely break. So all the rigid impression materials, non-elastic impression materials, well, they are contraindicated in case of the undercut areas, because they break from there. Then coming to the second one, second non-elastic impression material, which is impression compound. Well, the first one was mucostatic impression material. This is mucocompressive impression material. It is thermoplastic as well. Thermoplastic materials are those, the properties of these material is totally dependent upon the heat, right? Thermoplastic materials, they are manipulated through heat. That's why they are thermoplastic. Well, they are used to record the primary impression of the edentulous arches. Whenever a patient comes to you for a complete denture making, there are two steps of impression. One is the primary impression, the other one is the secondary impression. So impression compound is used to record the primary impression of the edentulous arch for the complete denture. So there are different names by which it is called in different books, like dental compound, model compound, modeling compound. Well, these are different names by which we can refer impression compound, and simply in lab work you call it as compo, right? It is available in the form of sheets, cakes, discs, and in the stick form as well. So most commonly it is either in stick form or in the sheet or cake form. Well, it has two types. Type 1 is low fusing and type 2 is high fusing. So there is a difference between these two. The type 1, which is low fusing, that is called as green stick compound, also called as the tracing compound. Well, whenever you record an impression from impression compound, you basically record it with the type 2, which is tray compound. Well, tray compound records all the impression, all the orodental, basically not dental, just oral structures, because this is edentulous patient, so there are no teeth present. That's why all the ridges, all the areas around your ridges. But on the sides of the impression tray, there is a need of another impression which is taken from the type 1, which is used for recording the border. That's why it is also called as border molding compound. On the sides of the tray, if you remember in the start, I told you, I showed you the edentulous arch impression. The main bulk of the impression was taken by the impression compound, and on the sides you just recorded with the help of the tracing compound, the green stick compound. So these two impression compounds are used for record the primary impression of the for the complete denture. Then coming to this composition, well, mainly it is a thermoplastic material because the properties are totally dependent upon the heat. Well, the main function is to increase the plasticity. It remains plastic, it remains workable, it forms a main matrix of your mixture, right? It has filler content as well. The fillers are in just spreading throughout the mixture of your matrix. Well, they lower the thermal conductivity, then they are lubricant present to give the flowability to impression compound. Then there are coloring agents for the color contrast. Color contrast is very necessary to form a clear demarcation between the impression material and the model. Now coming to its manipulation, well, it is I have again categorized it into different steps. The first step is the softening of the impression compound. The impression compound is softened by the warm water. Well, you take a warm water into the rubber bowl and then you insert the impression compound disc into it. It gets soft, so then you can easily manipulate it. So hot water bath is the method by which the impression compound is manipulated, and the next point is the MCQ, a very important MCQ. The temperature range of the hot water bath, 55 to 60 degree. It is from the Phillips Science of Dental Material. So that's a very important MCQ for your prof point of view. So once it is softened, you perform kneading. Kneading is just taking that soft material out of the warm water and then pressing it with your thumb and your fingers. That is called as kneading. So it is either dry kneading or wet kneading. Wet kneading is done for the disc shape or sheet shaped impression compound, and dry kneading is done for the green stick. That's the difference between these two. Well, kneading improves the plasticity, which is very important for impression compound to record an impression. Well, prolonged immersion should be avoided, and the temperature of the water is it should be within the range of 55 to 60 degree. It should not be overheated, because then the constituents of your impression compound will leach out, and it will not have the same properties, the same desirable properties that we demand from the impression compound, because the components have leached out, so it won't record the impression as you desire. Well, should not boil or ignite the material. Exactly the thing that I told you, that temperature must be within that range, because if overheating is done, or if boiling or ignition is given, the components will leach out. Well, the impression must be thoroughly cooled before withdrawal from the oral cavity. Well, once you load it into the tray and then you insert it into the patient mouth, well, there's one thing, triple syringe is present on your dental unit. You just spray the water from that triple syringe. It has water and air both. You press the button, the water with air, it comes out and it cools down all your dental impression. Then you remove it from the patient's mouth, right? Because if it is still warm, still hot, it means it can still be, it is still workable. You can still work on it. But once it is cooled, it is finally set. It is a thermoplastic impression material, so you can just give it heat, and you can reuse it, right? So that's why cooling is done before withdrawal, because if the cooling is not done, it means the material is not finally set. Cool water must be sprayed till the material becomes hard. Softening of the compound in warm water is recommended from removal from the cast, right? One of the steps that I told you in the start, that how you convert a negative replica into a positive one. You had an impression and then you inserted the soft plaster or hard plaster inside the impression to make the positive replica, right? In case of impression compound, what is recommended, that you insert that model you made from the plaster along with the impression tray and impression compound into warm water to remove the cast and to separate the cast and the impression compound. Why? Because this, as I told you, it is a thermoplastic material. It gets soft when the heat is given to it. So when you will insert it, rather than you just forcing it or using instruments to separate the impression compound from the model that you have made, the easy way is just take warm water, put the plaster model along with the impression tray into the rubber bowl having the warm water, and then after few seconds just remove it. The impression compound is going to be soft and you can easily separate it. Well, the properties, undercut performance recording is very poor, because it is, I told you, it is a rule of thumb. It is a general rule that all non-elastic impression material will not be able to record the undercut areas. The undercut recording is going to be very poor for all the non-elastic impression material. Dimensional stability is also not very good for impression compound, because it is a thermoplastic impression material, especially in these days, these summer season. You must have experienced it. The external environment, that the temperature is also very warm, and once you go into the prosthetic lab, there are burners everywhere. Some curing is being performed on one side, so the temperature is even more higher, right? So this temperature affects the impression compound, because the impression compound is a thermoplastic material and its properties are totally dependent upon the temperature. You give it a temperature, it will get soft. You just cool down the impression compound, it will get hard, right? So its dimensional stability is not very good, because even giving it some heat, it will change the dimensions. Well, impression may relax when with an increase in the room temperature. There, I've already told you this. In summer season, it is very difficult to record an impression from impression compound. So, what are the advantages and disadvantages of impression compound? Well, it is a biocompatible. That is a good thing. That is the first desirable property that we require from any material. It is also compatible with model and dye material. It means it gives no chemical reaction when it comes in contact with the model or dye material like soft plaster or hard plaster. It has adequate shelf life. Well, you can store it for a longer duration of time in your shelf. So that's why it has longer adequate shelf life. So every now and then you don't need to change your material. It doesn't expire that quickly. Well, disadvantage is the poor dimensional stability. As I told you, it is not dimensionally very stable. It needs water bath for the softening. Yeah, because in the start I told you the ideal property is that it should have minimum equipment and it should not be very technique sensitive. But this impression compound, recording an impression from an impression compound, is really very technique sensitive, because you need some extra equipment like uh, a kettle or something like that to warm the water, and then you place it into the rubber bowl, and then you soft the compound, and then you use it, rather than other materials which you simply mix with water and then you start using them. It is very technique sensitive, yes, because when you perform kneading, as I told you that kneading is performed with the help of your fingers and thumb. You perform kneading. There should not be any wrinkle formation in the impression, right? There shouldn't be any wrinkle, and that is where the technique comes while kneading. Once you will start using impression compound, you will see that it is very difficult to take out the wrinkles when you mix it. So there shouldn't be any wrinkles present. So that's why it is very technique sensitive, and you need to be very much expert after a few impressions recorded from the impression compound, that you eliminate all the wrinkles. So if the wrinkle will be present inside the impression, the same will be displayed in the plaster model and then your prosthesis, the final denture. So that's why it is very technique sensitive. Fine details not recorded well, because it is non-elastic impression material. It is unable to flow. It is mucocompressive, so it does not flow all around the orodental tissues to record the fine details. Well, now coming to the indications, where can we use impression compound? As I told you in the start, it is indicated for taking the primary or preliminary impression for a complete denture patient. A complete denture patient comes to you. I told you there are two types of impression that we take, two stages of impression, you can say. The first is the primary stage, and then the secondary stage. The primary stage impression is recorded by impression compound, and that's where it is indicated. For fabrication of the special trays, I told you in the tray section that if you want to record if you want to make a complete denture, you have to make a custom tray or the special tray, and these special trays are being formed by the impression compound. Contraindicated, the same in the undercut area. It is contraindicated, this small tiny triangle that you see between these two teeth number 29 and 28. You can easily see this small triangle. So when you will remove the impression compound, it will definitely break from here. Zinc oxide eugenol impression paste, the third non-elastic impression material. Well, it is available in two paste formulation. It sets by chemical reaction. It has one component which is zinc oxide, and the other one is the eugenol, which is a colorless liquid, and it is extracted from the clove. So it has a pungent, spicy taste as well. So, well, it is a two paste system. Paste 1 is a base paste, and paste 2 is the catalyst paste, right? So the base paste is always white, and the accelerator or the catalyst paste is always colored. So whenever in the viva, these impression paste, they are also present in the tray that is in front of the examiner. So just you take this impression tray and then you remove the cap, you will easily see the color, either white or blue. If it is bluish or any other color than white, you that is a catalyst paste. C for catalyst and C for colored. So colored paste is always catalyst, while the white paste is the base paste. How do we mix it? Well, there are the steps for mixing the base paste and the catalyst paste. Uh, we use an oil impervious paper pad or the glass slab and a flexible stainless steel spatula to mix. Well, along with these impression paste, here you can see the oil or wax paper pads which are used to for manipulation of the impression paste. So how do we record an impression? Well, in other impression materials you will see some 50 ml or 100 gram or something like that, but here in case of the impression paste, the equal lengths, the lengths are the main measurement. The equal lengths of both the pastes are taken onto the mixing pad or the glass slab if you are using it. You are going to take the equal lengths of both the base paste and the catalyst paste. Both pastes are mixed together rapidly. The mixing completes when the homogeneous color is formed. One paste has a blue color mostly, the catalyst paste has dark blue color, and the base paste, as I told you, is whitish, so you will get a light bluish color. So once you get a homogeneous color, it means that the mixing is complete and now it is ready to be loaded into the impression tray. In the next step, well, we load the mixed impression material onto the impression tray for recording the secondary impression. Always keep in this mind, the primary impression for complete denture was recorded by the impression compound. The secondary impression for the complete denture is going to be recorded by zinc oxide eugenol impression paste. So then it is loaded into a tray, and this obviously you have to clean your armamentarium, you have to clean your spatula and glass slab there and then. The properties: dimensional stability, well, it is satisfactory, not good, not bad. So okay, it is we can manage with that. Shrinkage is less than 0.1%. Okay, that is also very acceptable. Well, a patient feels some irritation due to eugenol. As I told you in the start, it is a pungent smell, a spicy taste. So patient is irritated to that, but not more. Since it is impression material, it is not inside the oral cavity for a longer duration of time, so it is still manageable. But there are certain impression materials which are eugenol free. It also has the adequate shelf life. You can use the impression paste and then you can store it into your cupboards for adequate period of time. Well, advantages and disadvantages. Well, if we come to the advantages, it adapts well to the soft tissues, which is a good thing. We want the impression to be as close as possible. It has low viscosity. That is also a very good very good advantage, that it flows easily all around the teeth and records the orodental structures. It has high accuracy. As I told you in the previous slide, that dimensional stability is good, so accuracy of the impression is also very good. It is inexpensive, so not much a burden on your pocket as well, being a dentist. So disadvantage: rigid when set. Well, being non-elastic is a very big disadvantage for all the non-elastic impression materials, right? So being rigid is a very big disadvantage. It cannot record the undercut areas. Obviously, being non-elastic impression material, once you remove it from the oral cavity, it will definitely break. Now, coming next, it may have taste in the patient mouth due to the eugenol, may have slight burning sensations. Well, that is also due to eugenol. If you keep it for a longer duration of time, it will cause burning sensation into the patient's mouth. Then it is a messy material. Yeah, obviously it is messy because after mixing there is a mess formed on the paper pad. It's good if you are using a wax paper pad for mixing zinc oxide eugenol impression paste, because you can easily just throw it away into the bin. But if you are using a glass slab, then it becomes very difficult to clean the glass slab once after mixing these two pastes. Indications and contraindication for recording, as I told you, they in complete denture making, there are two stages of impression: primary impression and secondary impression. Primary impression is recorded by the impression compound, and secondary impression is recorded by zinc oxide eugenol impression paste. So that is the indication for the use of the zinc oxide eugenol impression paste for making of the complete denture, the secondary impression or the final impression taking. And contraindicated, obviously, as always I told you, it is a rule of thumb, contraindicated in all the undercut areas. Then to compensate for the bad taste, the eugenol free zinc oxide eugenol paste is used. It is basically orthoethoxybenzoic acid. It is EBA. This is also a MCQ. Eugenol free zinc oxide paste is also called as XYZ, right? So it is orthoethoxybenzoic acid, EBA. That is the correct answer. So these are eugenol free. The patient doesn't feel any sensations or the bad taste. Well, and then lastly, we come to the elastic impression materials. Here, the elastic impression materials, well, they are divided into two types. I will only talk about the aqueous hydrocolloids today, and then we will arrange another lecture for the elastomers. Well, aqueous hydrocolloids. What exactly is a colloid? A hydrocolloid. Well, you should have a clear concept about it. A colloid is basically a substance, a mixture of two materials. When they mix with each other, either one of them remains soluble or insoluble in the solution. Well, that is called as a colloid, right? To explain it further, I will give you an example like sand in water. So there are two things, water and sand, but sand remains insoluble. Then the second example is salt in water. Salt is easily dissolvable in water, right? So that is also a solution. So both of them, either they remain soluble or insoluble, the solution is going to be called as a colloid solution, right? And if one of those materials, the substances that you are mixing is water, then it is called as a hydrocolloid. The examples that I gave you, one of the substance was water. So these are the hydrocolloid impression materials which we are going to talk about. So now I think the concept must be clear in your mind that what exactly a colloid is. Colloid is a mixture of two substances, and if one of those substances is water, that is called as a hydrocolloid. In dentistry, we use the impression materials which are called as aqueous hydrocolloids, either agar or alginate. Agar is a reversible impression material and alginate is irreversible impression material. Then obviously these elastomers are there. They are also elastic impression materials. But today we are going to talk about only agar and alginate. Agar, also called as agar-agar, it is galactose sulfate which forms a colloid with water. As exactly that I told you that colloid with water, hydrocolloid. When heated, hydrogen bonds are broken. Well, it is basically made up of hydrogen bonds between the agar composition. So when we heat it, these bonds are broken. They just separate from each other. The chains get separated, and then you can easily manipulate. It gets soft, and you can easily manipulate it, right? Well, this process is reversible. The gel, upon heating, converted into a sol state. Sol, you can get an idea that a solution state, a semi-liquid state, right? And then you again cool it, it forms a gel, right? So that's interchangeable physical nature of the agar, depending totally upon the heat. You heat it, it gets softer, it converts into a sol state. You just cool it, it converts into a gel. It is, that's why it is also a thermoplastic material. I mentioned you one more thermoplastic material right before this one, which was impression compound. The manipulation was dependent upon the heat. That's why it is called as thermoplastic. So whenever any material which is going to get soft by application of heat, that material is thermoplastic material. Just keep this thing in mind for all the impression, all the dental material that you are going to study throughout your course. So thermoplastic materials are basically dependent upon the heat. Well, it can be used repeatedly. Yeah, obviously it is a reversible impression material, so you can easily disinfect it and then use it on the other patient as well. Well, it is supplied in two forms, either a syringe material or a tray material. The tray material is formed it is available to you in this tub form. The small tubs are available, like you see it in the picture next to it. And then syringe material, well, they are available in the syringe form, where they are thin consistency material. Well, requires careful control and expensive equipment. Well, that's a disadvantage, that you need an expensive equipment, which I am going to show you in the upcoming slide. That the equipment for mixing agar is not very simple. It is also very expensive. Dimensionally unstable, because it is a thermoplastic material. It is always, every thermoplastic material is always mostly going to be the dimensionally unstable. Well, this is the equipment used to manipulate agar impression material. Well, actually there is no manipulation needed for agar. You just place the agar into different compartments. The special conditioning unit is used to manipulate or condition the agar, right? Here you can see three different chambers in the conditioning unit. The water in the conditioning unit, it should not be contaminated during the use, so that should be also kept in mind. Here I have just used this picture so that you can easily understand what exactly is the function of each and every compartment of the conditioning unit. So number one, it is the liquefying chamber. Okay, the patient comes to you, the patient is resting on the dental unit. You know that you need to record an impression from an agar impression material. What exactly do? You just put the agar in the first compartment of the conditioning unit, which has the temperature of 100 degrees centigrade, for 10 minutes. That is the liquefying chamber, right? That is the liquefying chamber. And if you remember in the first slide, if you give it heat, it will convert into a solid state. Then after 10 minutes you just put it, take it out, and then you insert it into the second chamber, which is the conditioning chamber, for about some time, until you're going to use it. The temperature is getting lower, 65 degrees centigrade. The temperature of second chamber is 65 degrees centigrade. Then when you are going to use it into the patient's mouth, just before that you just place it into the third chamber. The temperature is about 45 degrees centigrade. It is the tempering chamber, and you keep it there for about 3 minutes. After 3 minutes you just take it out, and then you use it, dispense it on the impression tray, and you record the impression. Well, there is some science present in this change in temperatures. Obviously it was converted to a solid state, it was converted to a usable state in the first chamber. That is the viva question mostly asked. Well, I sometimes ask it, that it was converted to the solid state in the first chamber, then why you had these two chambers? And well, that's an extra expense. Why you need to create two extra chambers for that, to use it, whereas it was already converted into a solid state? Well, the answer to this, the concept to this thing is that you cannot insert a material with a temperature of 100 degrees centigrade inside the patient's mouth directly. So what exactly do you see here? That you're lowering the temperature in each chamber, and normal temperature of the oral cavity, well, that is about 32 to 37 degrees centigrade. So once you reach the third chamber, which is the tempering chamber, the temperature is already lowered to 45 degrees centigrade, and when you take it out, place it on the impression tray, the temperature is even more lowered, right? So then you can easily insert it into the patient mouth. You cannot insert it into the patient's mouth when the temperature is too high. So just keep this thing in mind. So there is a reason why this 3-unit chamber is used for agar. Okay, the advantage is that no mixing is required. You just need agar, you just replace it in different chambers, and then the whole work is done. The surface detail recording is very good. Well, it is inexpensive, but initial expense is too much. The 3-unit conditioning unit, well, that is expensive, but once you get it, then the material itself is reversible, so you can use material again and again, so the cost becomes lower, but the initial investment is quite high. Well, initial that the coming to the disadvantage, the initial expense, well, that is the main disadvantage. It is technique sensitive. You need to be very much expert in using the 3-unit chamber, because without that it won't be possible for you to record the impression. Tear strength is very poor. It is easily tearable. Once you remove it, it gets teared quite easily. Dimensionally unstable, because it is a thermoplastic material, so it is bound to be dimensionally unstable. Well, okay. Now coming to the indications and contraindications, full arch impressions are recorded. You can also record the quadrant impressions as well from the agar impression material, so they can also be used for the fabrication of the complete dentures as well as the partial denture. Okay, the contraindication is the bulky tray. The tray that is used for agar is not the normal trays, right? It is a special tray which is only specifically used for recording the agar impression material. It has certain tubings in it. There are tubes present inside it in which the water circulates, right? The water will once you use that tray inside the patient mouth, and the water keeps on circulating, keeps on cooling the impression material, so that once it gets cooled, it gets set. If you will heat it, it gets soft. If you will cool it down, it will set, right? So that's the science behind the agar impression material. So that special trays are used for the recording the impression for the agar impression material, and they have special tubings from which the cold water circulates every now and then. Agar is basically just like if you might have eaten jelly in your home. So it is exactly just like that material. You just cool it down, you just make the jelly, it is warm, and then you place it into the refrigerator to cool it down, and then you can eat it, right? So this is the same thing. The agar is the same, just like the same jelly material for an impression, for use to be used as an impression. You cool it down, it will get set. Then lastly, the alginate impression material. Well, it is the most commonly used impression material. It is viscoelastic in nature. It has very good elastic properties. Um, Now coming to the manipulation, well, this impression material is most commonly given in the OSPE examination, right? When there is because it is very inexpensive impression material, so that's why it is easily given into the patients into the exams. So powder and water ratio, they are basically used as per manufacturer advice. Normally they are equal parts of powder and liquid are used, and powder is added to the water. The water is basically used to wet the inner surface of the rubber ball, and then you add powder to it, and then you start manipulating it. The main idea behind this is that if you will insert water, powder first and then water, then there are chances that the manipulation will not get smooth and creamy, and there is incorporation of air bubbles as well. So once you get smooth creamy mixture, What exactly do you do? You just lift the spatula and you see if it is not dripping, then it means that it is ready to use inside the oral cavity. You just keep on mixing it, and there is a vigorous figure 8 movement that you give. So these are the steps you should keep in mind once you are manipulating, because these stations, I being an examiner, I have told you that for last 11 or 12 years I am taking these university exams, and whenever I go to a station and the student, he or she has to manipulate alginate, the only thing I see is this figure 8 movement. We will not keep on standing there on your head for as long as you keep on manipulating it. We will just see the technique. Okay, you are manipulating it right, and then we just ask you a couple of questions and then we leave. So just technique is important. So these technique I've clearly mentioned stepwise in all for all the impression material. Well, you get a smooth creamy mixture. It should not once it stops dripping, you just load it into the impression tray. You just insert it into the patient's mouth, and then you keep the patient mouth, ask the patient to perform certain movements, right and left, and tongue movements, and then you record the functional impression. Now coming to the properties, well, it is easy to manipulate, comfortable for the patient, inexpensive, require very inexpensive instrumentation, right? So this is very ideal material to be used, because it is easy to manipulate, just need rubber and ball, not very technique sensitive like agar and impression compound, so it is very easy to maneuver. Now coming to the advantages and disadvantages, advantages are the same: easy to manipulate, it has elastic property, inexpensive, it is rapidly setting, so your patient doesn't have to keep the mouth open for a longer duration of time. It is hydrophilic in nature. I told you in the very first slide that hydrophilic is the main property that we desire as a dentist, because then it will get more closer in contact, it will absorb even saliva and get more closer. But there is a difference between alginate and the impression plaster. It does not cause any dry sensations or exothermic reaction. So disadvantage of alginate impression material is poor dimensional stability. So you need to make the model or cast as soon as possible. You don't have to keep on waiting for longer duration of time. Just record the impression, ask your assistant to make the model as soon as possible, disinfect it and make the model. Satisfactory details are recorded. Well, that is still acceptable. Room temperature and humidity can affect the working and setting time. Well, that's exactly, if the temperature is quite hot, then there is a chance of syneresis, the loss of water from your hydrocolloid impression. It has water, right? I told you one of the component is water in colloid. It is called as the hydrocolloid. So if the temperature is quite high, the water is going to evaporate, and definitely your impression is going to be sacrificed. Then indications: it is used to make the steady models for diagnostic purposes, for removable partial dentures, for making the bleaching trays, for making the mouth guards that the sportsmen, especially the boxers, they use. The mouth guards are also fabricated. The impression is taken from the alginate impression material. For the fabrication of the special of the or the custom trays, well, alginate is used for that as well, because it is a very cheap or very inexpensive material. So we use it for a lot more in purposes. Not accurate for fine details. Fine details, just like if you are recording an impression for an implant or a crown or bridge, then it is not indicated to use an alginate impression material. Obviously, you are getting a very high cost, very high price for these treatments. The patient is paying you, so why not you use a very good material which has much more dimensional stability, like elastomers. So alginate is not used for these fine detail recording. Rather, elastomers are used for them. Then gag reflex. In case you are the assistant is not very well trained, he or she made a very thin mixture, there is a chance that it goes into the the patient is sitting backwards with the mouth open, so there's a chance it will go into your pharynx, right? So the gag reflex is always there. So you need to have a recommended ratio. Then this is the last slide of today's lecture, the laminate technique, the technique in which the both hydrocolloids, agar and alginate, are going to be used together. So this technique is called as laminate technique. It is a recent modification combining alginate and agar technique. So both, I told you, these are both hydrocolloids. One is reversible, agar is reversible, alginate is non-reversible. How we are going to use them together? This is a modification. Hydrocolloid in a tray is replaced by chilled alginate, right? So first, exactly what we are going to do, we are going to refrigerate the alginate for some time, right? Chilled alginate and agar is added through a syringe. I told you that agar is in two forms, either it is in the tray form or the syringe form. So syringe form is used here. So alginate, before taking an impression, you put the alginate into the refrigerator for some time. It gets chilled, it gets cooled, and then you mix it. You put it into the impression tray, and then you just use the agar in a syringe form to just laminate that impression, right? And then alginate, how alginate gets set by the chemical reaction, the normal reaction of alginate, whereas agar gets on set. I mean, it just forms a gel when it comes in contact with the cool alginate. I told you that agar only gets set once it is cooled. So the alginate underneath it is cooled, it is in chilled form, so that's why the agar will also get set. The agar is in contact with the prepared teeth. Agar is coming in contact with the, now you insert it into the patient's mouth. The agar comes in contact with the prepared teeth, and the alginate is just underneath the agar. So disadvantage is that there is not a good bonding between the agar and alginate. That's the main disadvantage. Otherwise, together, once they are used, they produce excellent results. They give you very fine details of the both of these impression materials. So that's all for today's lecture. I hope it was helpful and useful for you. We have covered some important terms, the classifications, the non-elastic impression material and the elastic impression material. We will arrange one more lecture on the elastomeric impression materials as well in coming days. So please, you can subscribe to this DentoScope official YouTube channel. So once the next lecture is scheduled, you will get the notifications and you can easily catch us there on YouTube, or you can like and follow on Facebook, on our official Facebook page or Instagram. But for videos and lectures, please subscribe to DentoScope official YouTube channel. I am Dr. Rashid Hassan. Thank you so much. Inshallah, see you all soon. If you have any question, just write in the chat, the comment section below. I will get back to you, and then I will answer all your questions, inshallah. Thank you so much. Take care. Allah Hafiz.